السلام عليكم ورحمة الله. الله يعطيكم العافية يا جماعة. أعرفكم بنفسي، أنا دكتور محمد العرجاني، أحد أعضاء هيئة التدريس في قسم علم الأمراض في كلية الطب، وراح أشارك زملائي في تدريسكم مادة General Pathology Med 231. أنا راح أعطيكم أول مجموعة من المحاضرات من وحدة Chapter Neoplasia. مرجعي ومرجعكم للمادة راح يكون روبنز A Basic Pathology Textbook, the latest edition of it. Currently the latest edition is the 10th edition. محاضرتنا الأولى راح تكون محاضرة تعريفات بالدرجة الأولى حول مصطلحات تستخدم في هذا الموضوع. وأول مصطلح راح نحكي فيه هو مصطلح اسم الشابتر Neoplasia. Neo, we can divide the word into two parts, neo and plasia. Neo means new plasia growth, so neoplasia is new growth. Neoplasm is the new growth of transformed cells producing a mass. So the end result is a mass produced because of the proliferation of transformed cells. Neoplasm is the best term to use to reflect this meaning. However, there is another word we call tumor, T-U-M-O-R. Tumor, it is a synonym used in medical literature for neoplasm, and we can use it interchangeably with neoplasm. However, if we come to the accuracy in literature, neoplasm is more accurate for this use, because a tumor can mean any swelling in the body because of any process, whether it is neoplastic or inflammatory or edematous, etc. Now we come to the transformed cells. What do we mean by transformed cells? Transformed cells are cells actually that have undergone several mutations leading to features of uncontrolled growth. So their growth is not well controlled by the normal controlling mechanisms which control growth of normal tissues and cells in the body. So the cells proliferate without any control, any check on them. They are useless. Our bodies don't need such cells. And I'll give you an example. If we come to the insulin producing cells in the pancreas, they are present in normal number, that they produce a normal amount of insulin into the blood. If these cells proliferate and transform and proliferate and produce a neoplasm, such high number of cells will produce excess amount of insulin. Actually, we don't need such high number of cells. We don't need such high number of insulin in our bodies, and even it might be harmful to the body. It might produce hypoglycemia. The third feature is that such transformed cells are persistent in their proliferation, and they stay for long. According to the behavior, neoplasms are divided into two main types. The first is benign neoplasm. Benign neoplasm is defined as a neoplasm with microscopic and gross characteristics considered to be relatively innocent, implying that it will remain localized without or with limited ability for local spread into adjacent structures. So usually the tumors are surrounded by a capsule or are well maintained and respect the surrounding tissues, and they have no ability to spread distantly in general. بالمقابل malignant neoplasms اللي هي الأورام الخبيثة هي neoplasms which can invade and destroy adjacent structures and can spread to distant sites, i.e. can metastasize to distant sites away from the local site. ممكن نشبههم هذول malignant neoplasms ب يعني in the wars في بالحروب بصير استخدام مثلا اللي هي الوسائل الأرضية من دبابات مدرعات. هذه بتنتشر انتشار من مباشر باتجاه خلينا نحكي البلاد المحيطة في البلد اللي بينتشر منه هذا الجيش، فهذا انتشار مباشر. بالمقابل الطيران والصواريخ تنتقل بشكل يعني بعيد باتجاه أماكن بعيدة that can skip the adjacent يعني places. فعملية تشبيه هيك بسيطة شوي لتوضيح الأمور. البناين تيومرز أو نيوبلازمز اللي هي الأورام الحميدة زي ما حكينا، وهذول التيومرز بيكونوا بالعادة amenable to local surgical resection. بالمقارنة معهم malignant tumors may not be controlled and cured by local resection. Both benign and malignant neoplasms are of many types when it comes to typing the tumors in other different ways. Cancer. Cancer is a general term for all malignant growths of whatever type. شو ما كان نوعه ومصدره، ما دامه malignant فهو يعني نطلق عليه مصطلح عام اسمه cancer. Oncology is the study of tumors in all their aspects, benign or malignant. This is oncology, and the doctors who deal with tumors in all their aspects, diagnostic and management wise, we call them oncologists. Neoplasm is an abnormal mass of tissue. The growth of this mass exceeds that of normal tissues and is uncoordinated by the normal controlling mechanisms which control normal tissues. This mass persists in the same way even after removal of the stimulus which produced the change. So again, we are focusing on the features of transformed cells in a different way. We classify neoplasms in order to provide help to our colleague clinicians in the diagnosis and to allow them to give the correct treatment. Neoplasms are classified according to, first, the cell of origin, from where they are derived. Second, their behavior, as we said, benign and malignant. And the third way of classification is the degree of differentiation, by which we mean the degree of resemblance of the tumor or tumor cells to the cells of origin. Structure of neoplasms. The neoplasms are composed actually of parenchymal cells and stromal cells. parenchymal cells هي الخلايا الرئيسية اللي في الورم اللي بناء عليها يسمى الورم. Stromal cells هي support, okay, supporting tissues. The amount and type of stromal cells may contribute to the consistency and appearance of tumors. فهي بتساهم stromal cells في السبورت وفي إعطاء المظهر العام للورم من ناحية consistency and appearance. If there is a stromal proliferation with excess, this will give firmness to hardness to the tumor consistency, and the tumor may then be described as a scarce tumor because of this excess amount of stromal proliferation and collagen deposition, and the whole process can also be called dysplasia or dysmoplastic reaction. If there's lack of stromal cells on the other side, the tumor may become maybe soft or even cystic. The parenchymal cell may arise from either one germ cell layer or more than one germ cell layer. As we know from embryology, the germ cell layers are divided into endoderm, mesoderm, ectoderm, and each of these layers produces certain tissues, as we all know. And tumors, parenchymal cells in tumors can derive then from epithelial cells, from connective tissue cells, from like endothelial cells, from blood, from bone marrow cells, from lymph node lymphocytes or other cells in the lymph nodes, and from other origins. Now we have a term that we call mixed tumors. Mixed tumors are tumors which have components from one or more germ cell layers, but they are defined as tumors that have actually two components of tissues. For example, they may have epithelial component and stromal mesenchymal component, being both parenchymal cells. And many people explain the situation here as the progenitor cells proliferate and differentiate into more than one way. They can differentiate into epithelial and stromal cell components, so the tumor is then called mixed. Back to the consistency. Look at this example. This is the uterus and the adnexal structures on both sides. And this is a large cystic mass. Cyst means fluid-filled sac-like mass lesion. Look at this. This is a cystic mass that has soft and glistening appearance on the surface and smooth surface. And if you cut through this mass, you will find it containing a lot of fluid. This mass is a cystic tumor in the ovary, and in this example, it is called the cystadenoma because it's derived from epithelial cells and is benign, and it's called serous here because it is derived from a certain type of epithelial cells that resemble the fallopian tube epithelium. So we call this serous cystadenoma. Now we will come to the terminologies pertaining to the diseases. Look at this example. This is a cancer in the breast. You can see the cut section through the tumor, showing first of all ill-defined margin with the surrounding tissues. So the tumor is invasive into the surrounding tissues. That's why it is malignant. And the second point, you can notice variation in the color of the tumor, and you can experience this by cutting through the tumor. You will find the tumor to be firm to hard on the periphery, but upon reaching the central side here, which is pale here, it's more difficult to cut because of the harder consistency, because of the increased amount of stromal or fibrous tissue support or desmoplastic process in this part of the tumor. Now, according to the cell of origin, we divide tumors into tumors derived from epithelial cells or tumors derived from other origins. Now, first we start with epithelial cell origin tumors. These can be divided into benign and malignant. The first group in the benign is called adenoma. Now, from this you can notice the suffix oma, O-M-A, means usually in the terminologies pertaining to tumors or neoplasms means benign neoplasm. في exceptions, there are exceptions لهذه القاعدة راح نمر عليها بعد شوي. So oma means benign neoplasm in general, and adeno means something derived a prefix that means something derived from glandular epithelial origin. So adenoma is the summation of adeno prefix and oma suffix. Together, you delete one O, so it will read as adenoma. It is a glandular epithelial tumor, often producing a secretion like a mucin, and this secretion may be intraepithelial or intraluminal, inside the lumen of the gland. The gland, when you say gland, is a collection of cells producing a lumen in the center, and the mucin produced here can be within the epithelial cells themselves or can go into the lumen of the gland. Cystadenoma is an adenoma with cystic consistency, as we saw in this example, serous cystadenoma of the ovary. So it is a benign neoplasm with cystic consistency and derived from a glandular epithelial origin. بالمقابل, البابيلوما is another benign epithelial neoplasm, but this tumor forms finger-like projections or fronds from an epithelial surface, and these finger-like projections have outer side covering or composed of epithelial cells, usually squamous epithelial cells, maybe maybe transitional epithelial cells if we talk about the urinary system, urinary bladder and related structures. And the central core of these finger-like projections is composed of connective tissue core, fibrovascular core or center. The word polyp is a general term which is a projecting mass from the mucosal surface of a hollow organ. The word polyp could be neoplastic, could be non-neoplastic. So it is a very general term. We use it commonly in neoplasia related to mucosal surfaces of a hollow organ. This is a papilloma here and there. Let's look at this picture. This is a papilloma, squamous epithelial lining of stratified nature, with the center being, or the core being, fibrovascular tissue. So this is papilloma of squamous derivation because the epithelium is squamous. في papillomas بتصير بالurinary bladder نسميها transitional cell papillomas. بالمقابل هذه structure of adenoma from the colon. This is the benign mucosa, normal mucosa adjacent to the projectile polyp. نفس الشيء هون. This is the muscularis mucosa. This is the submucosa. This is the muscularis propria, and the outer layer is the subserosal fat, followed by the serosal covering of mesothelium. These are the layers of the colonic wall, from inner side to the outer side. Let's come to the inner side, mucosa. You can notice here a projectile polyp from the mucosal surface into the lumen of the colon. And this polyp is composed of a high number of glands, as you see. The glands هذول are similar to the glands in the adjacent mucosa, but they are increased in number first, and they have increased number of cells in them with probably larger nuclei that gives them the darker appearance compared to the surrounding mucosa. So يعني هون we can see more compact glands accumulating compared to the glands in the adjacent mucosa. However, this projectile mass, if you look carefully, it respects the adjacent or let's say the underlying connective tissue اللي هي submucosa. There's no infiltration into the submucosa, no invasion into the submucosa or structures below the submucosa. So this lesion has respected the adjacent structures, has not invaded them. That's why we call it benign. It is called adenoma because it is oma, it is benign, and adeno because it is composed of glands of epithelial cells, columnar epithelial cells, forming glands. These compose the mass. So it is an adenoma. In other words, we call it adenomatous polyp. Now we come to malignant epithelial tumors. These are called carcinomas. Carcinomas, not omas, carcinomas. And according to their origin, we divide them. We have the squamous cell carcinomas are the malignant counterpart for the squamous cell papillomas. They can happen in the skin, in the mouth, in the cervix, in the bronchus after metaplasia from respiratory epithelium to squamous epithelium in response to the smoke irritation. بالمقابل adenocarcinoma is the carcinoma, which is the malignant epithelial neoplasm that derives from glandular epithelial origin. So this is the malignant counterpart for adenoma. We can see it in the gastrointestinal tract, GIT, in the endometrium, in the breast, in the kidney, the thyroid, where you have glandular epithelial cells. Now we come to tumors coming from connective tissue origin. Benign ones, their names end with the suffix oma, and their prefix in the names relates to the type of tissue they are derived from. When we say fibroma, means benign neoplasm coming from fibroblasts or fibrous tissue. Lipoma, benign neoplasm coming from fat cells or adipose tissue. Chondroma, benign neoplasm coming from cartilage cells, from chondrocytes. Osteoma, benign neoplasm coming from bone. Leiomyoma is a benign neoplasm coming from smooth muscle. Rhabdomyoma is a benign neoplasm coming from skeletal muscle, and so. I remembered. Angioma or hemangioma is a benign neoplasm coming from vascular origin, vascular endothelial cells. However, the malignant counterpart for these tumors is called sarcoma. And we add a prefix that defines the origin. So osteosarcoma, malignant neoplasm of bone, liposarcoma of fat, angiosarcoma of vascular origin, leiomyosarcoma of smooth muscle origin, rhabdomyosarcoma of skeletal muscle origin, chondrosarcoma of cartilaginous origin, fibrosarcoma of fibrous origin. So as for the nomenclature, the cell of origin is defined in the prefix part of the name, and the suffix usually denotes the behavior of the tumor. So the suffix oma means usually benign neoplasms, while the suffix carcinoma or sarcoma means malignant neoplasms. And these are what we just talked about. Now, there are some exceptions for this rule of terminologies, like lymphoma ends with the suffix oma, but is by definition a malignant neoplasm of lymphocytes. Glioma ends with the suffix oma, but is by definition a malignant neoplasm of glial cells in the central nervous system. Melanoma, oma is a suffix that usually means benign, but this is actually a malignant neoplasm of melanocytes or nevus cells. بالمقابل البناين counterpart إلها بنسميها nevus. So from these three words you can notice that there are exceptions for the rule of the suffix oma being benign. Leukemia means malignant neoplasm of white blood cells. Now, as for these terminologies of nomenclature, you can notice details in a table in the beginning of the chapter where you can go through. But our main focus will be on the terms mentioned in the lecture. Some tumors are mixed, as we said. Mixed tumors عرفناهم قبل بالبداية, لكن mixed tumors can derive from a single germ cell layer or from more than one germ cell layer. Those derived from a single germ cell layer, they are derived from one germ cell layer, but they differentiate into more than one type of cells. And the best example عليها is mixed tumor of salivary gland. In mixed tumor of salivary gland, there are two components, and they both are neoplastic. The epithelial component forming aggregates or glandular structures, and the myoepithelial component or stromal component with a stromal background that looks myxoid or chondroid, etc. Now, such tumors happen in the salivary glands, especially in the parotid gland, and they can be divided into benign and malignant. The benign ones are called, in other words, benign mixed tumor of salivary gland or pleomorphic adenoma, and the malignant are called malignant mixed tumors of salivary gland or carcinoma X pleomorphic adenoma. In the breast, there is a similar lesion that we call fibroadenoma. This is a lesion that happens in young ladies usually and is freely mobile in the breast without attachment, so it is a good sign. It is called fibroadenoma because it's composed of two components and still till now is considered a mixed tumor, as it is composed of epithelial component, epithelial glandular component, and fibrous or stromal component, fibro. Oma means benign. However, the main neoplastic part of the lesion is the stromal component, the fibroblastic component. This is the main component, neoplastic component. Fibroadenoma of the breast. Okay. بالمقابل في عندنا tumors that come from more than one germ cell layer, maybe 2 or 3 germ cell layers, and are made of variety of parenchymal cell types and formed by totipotential germ cells that are able to form ectoderm, endoderm, and mesoderm. These tumors are called teratomas. Teratoma can be benign or malignant according to having or not having immature components, and depending also on structure, the site, the age, and the gender of the patient. Teratoma of the ovary, for example, may contain skin, sebaceous and mucous glands, hair, cartilage, bone, teeth, respiratory epithelium, glial tissue. All of these components can be present in variable compositions, either part of them or all of them can be present in the same lesion. The usual location of teratoma is the ovary or the testis. Look at this example. الواحد ممكن يفكر إنه هذه skin biopsy, لكن actually this is an ovarian cyst, cystic ovarian mass, okay, with skin-like tissue, squamous epithelium with keratin and underlying sebaceous glands and fibrous tissue. And the other picture here shows respiratory type epithelium, اللي هو columnar pseudostratified ciliated epithelium with underlying mucous glands and underlying bone and marrow spaces which contain hematopoietic cells. So this is the composition of the teratoma. إذا ما في immature components بنعتبرها benign, بنسميها dermoid cyst أو mature cystic teratoma because it is usually cystic in the ovary. إذا فيها immature elements صارت هون malignant teratoma. Now we come to tumors of primitive fetal origin. Blastoma is a suffix part of the name that indicates the tumor comes from immature tissue. So the tumor, the suffix here ends with oma. Oma usually means benign neoplasm, but here no, it doesn't mean benign. It means usually malignant neoplasm that usually are bad and are derived from immature tissue. According to the origin, if coming from the kidney, we call them nephroblastomas. If coming from the retina, we call the tumor retinoblastoma. If coming from the liver, we call it hepatoblastoma, etc. The great majority of these tumors are malignant and occur in infants and children. Some tumors have names that do not conform with general rules, as I said before. melanoma واحدة منهم, lymphoma واحدة منهم, وفي عندنا كمان seminoma ends with oma, بس هي مش benign. It is a tumor, a malignant tumor that comes from testicular germ cells. بعض التيومرز بيتسموا بأسماء أشخاص، إما هذول الأشخاص بيكونوا الساينتست أو الباثولوجيست أو الفيزيشن اللي اكتشف هذا الورم، زي هوتشكن ليمفوما، هون ويلمز التيومر، أو ممكن تكون الأسماء يعني مسمية على اسم المريض، أول مريض اكتشف فيه هذا المرض. عندنا التيبل 6.1 nomenclature of tumors في فعليا صفحة 192 according to the latest edition. هاي فيها التيرمز اللي بتخص nomenclature of tumors. It's good to have a look at them and to remember what we mentioned in the lecture here. Some tumors are not true neoplasms. Hamartoma, for example, ends with oma, right? But it's not a true neoplasm. It is a tumor-like developmental malformation. بصير فيها abnormal mixing of normal components of the organ. يعني هذول components موجودين هون طبيعيا موجودين في هذا الأورجن، لكن they are abnormally mixed بالorientation, arrangement أو بالquantities. The best example on this is lung hamartoma. Choristoma is a congenital anomaly where there are different types of tissues growing ectopic to the region. يعني في tissues تتجمع هون موجودة في مكان معين، بالأصل مش لازم تكون موجودة فيه. For example, Meckel's diverticulum in the small intestine containing gastric tissue. Gastric tissue هون ectopic to the site. Pancreatic heterotopic pancreatic tissue موجود في الستومك أو في الانتستين، فهذا يعني مش لازم يكون موجود هون. this is called these lesions are called choristoma. Both hamartoma and choristoma are benign lesions that are non-neoplastic and they usually do not become malignant. Now the last for today is how to differentiate between benign and malignant tumors. كيف تميزوا عن بعضهم؟ تميزوا in different features including the differentiation and anaplasia, which relates to the degree of resemblance of the tumor to the normal cells of origin. سرعة نمو الأورام, rate of growth, the presence or absence of a capsule, and the border of the tumor, the local invasion, and the distant metastasis. We will discuss these in further detail in the following lectures. الله يعطيكم العافية.